Hi, my name is Dr. Denise, and this is this week's A Dose from Dr. Denise, where I hope to teach, show, and inspire you how to release your God-given health and life potential. Happy Sunday. I hope you're having a really awesome day. I want to share something that happened to me about 5 or 6 years ago that really taught me a very, very valuable lesson. So I was invited to speak to a group of women at a community college event. And I would say there was about 100 women in the room. It must have been in the month of October because they asked me to present on tips on preventing breast cancer. And so I had put together what I thought was a really good presentation. I had very good slides, a lot of accurate information on breast cancer and how certain lifestyle factors relate to increasing your risk for breast cancer. And I think I wore a really pretty dress, and at the end of it, I thought that I had done a really good job. I had prepared for it, I had good slides, I had good structure to my talk, and it was well received to a degree, but I definitely got the sense from the audience that something was wrong. And I found out the next day through a woman who had attended the event that was one of our patients. And she had expressed, not directly to me, but to my partner at the time, that I wasn't empathetic to the breast cancer survivors in the room or women who in fact were going through breast cancer at that moment. And I understood what she was talking about. Nobody wants to be responsible for the disease that they're going through or somehow to think that something they've done caused it, and I totally get that. So I decided then and there, and I haven't always lived by this, but just doing this few minute video right now is reminding me that I decided that I really don't ever want to speak on something that I haven't gone through. So I've not had breast cancer, and I can't claim to walk a mile in those shoes because I haven't. I'm grateful to God that I have not had breast cancer. I just recently had a full exam and got another clear check from breast cancer. So what I want to share with you for the next few minutes is 3 specific things that I know 100% emphatically, without a doubt, will promote your health. And by doing that, it reduces your risk of all diseases, including breast cancer. So if you're going through breast cancer, if you have friends or family that have gone through breast cancer, if you've lost loved ones to breast cancer, you're on my mind, heart, and soul, in particular for the month of October. And every time I see a pink ribbon, I'm going to pray that all the money that we raise, especially in the month of October, goes towards research and development of the genetic causes of breast cancer, because I think that's where most of that money should go, is preventing the genetic causes of breast cancer. But what I do know about your genes is they can be turned on or off. I've talked about this before in my previous doses. It's called epigenetics. And so there's things that we can do on a daily basis that promote good health and therefore possibly can turn those genes off. And so that is what I want to speak on, the 3 things that I am an expert on, and I feel very confident in sharing these 3 tips of wisdom. So what is the first thing that's incredibly important to promote good health? The one thing is keeping your body mass index below 30. Now, I recently polled a group of girlfriends and I asked them, what is body mass index? And of the 6 women, not one of them knew it. So I thought that that was a pretty common term, and obviously it's not. Body mass index has nothing to do with body composition. It's not your percentage of body fat. It's literally just a height and weight scale. And I like it. I think it's better than the metropolitan scales from years ago. Body mass index is a metric measurement. It's your weight in kilograms divided by your height in centimeters squared. So because you can't do that math in your head, and neither can I, all you have to do is Google body mass index and you'll find a dozen different calculators. You'll enter your height and your weight, most likely your height in inches and your weight, and it will calculate your BMI. Your body mass index wants to be below 30. Now, there are some people that throw body mass index out of the window and say it's not valuable information, and I think that's like throwing the baby out with the bathwater, because of course knowing your percentage of body fat is very, very important, but there's very few tools out there that will give you a really accurate body fat. There are some, and certainly, if that's available through your chiropractor's office or through your fitness center. I know the new gym that I belong to now has a really accurate body fat tool. But I can promise you that if your body mass index is over 30, then you are definitely carrying too much weight on your frame. And unless you're taking steroids, which I hope you're not, then it's mostly fat, or it is too high a percentage of fat. So when you want to keep your BMI below 30. At 30 is when all the bad stuff happens, and in that bad stuff is the category of all the different cancers. The second thing that's critical to be aware of this number is your waist measurement. Now, a lot of times we take our waist measurement at the belly button, but I would encourage you to take your waist measurement at the widest part of your middle section. And usually that is below your belly button. So go to the widest part of your lower abdomen and measure that. For a woman, that wants to definitely be below 35 inches. And if you're a petite woman, it wants to be below 32 inches. And for a man, it wants to be below 40 inches. Now, why is that so important? Is it because I want you to have six-pack abs? Nope. It's because visceral fat, belly fat, kills. It is a very active endocrine gland in the body. I learned that years ago, and I couldn't believe it. I thought fat just sat there and did nothing and made your jeans tight. It actually pushes out lots and lots of hormones, and one of those hormones is estrogen. So that's not cool for guys, right? And it's definitely not cool for women, because that circulating estrogen attaches to receptor sites. And if you have an estrogen-dependent tumor growing in your breast, then that estrogen is going to attach there, and it's going to increase that risk for breast cancer. So belly fat is very, very important. So those first two tips relate very much to what you put in your pie hole. And so I don't want to get too off track about eating right and drinking right, but suffice it to say that eating less, eating more plants, and drastically reducing your alcohol consumption, because just 3 drinks a week increases our risk of breast cancer by 15%. So if you have a history of breast cancer, or you know family members, or you've had it, then you've got to reduce your alcohol consumption, because you're not helping your own cause. And of course, reducing your sugar and poor quality fats, eating healthy, eating less, more plants is critical. The third tip I want to share with you, I think, is perhaps the most important. The first two have to do with physical things we can measure and things that we can do. But the third thing has to do with your thought life. And I talk about this almost every dose, that your thoughts matter. Your thoughts are a boomerang that we put out to the universe, and they circle back to us. And so they really, really matter. And my biggest concern with all of the breast cancer awareness is that it becomes breast cancer fear. And what we fear, we attract. You know, what we fear, we attract. The opposite of love is fear. And so when we vibrate at a level of fear, in particular when it comes to cancers, then we are more stuck in the fear of breast cancer than in the love of health and health promotion. And so I would just ask you to think, where are your thoughts going? Joyce Meyer says, where the man goes, the mind follows. Are your thoughts consumed with fear of getting certain diseases or cancers, or do you put more of your thoughts on all the wonderful things that you can do to remain healthy, of which one of them, which is amazing that God has given us this, is how important our thought life is. We actually get to choose our thoughts, so we can consciously choose our thoughts versus subconsciously letting our thoughts choose us, and we can choose to put good thoughts out there to the universe. That's why I think that early morning time with God is so crucial. So that's this week's A Dose. I'm going to close in a prayer. I want to change the structure of these doses a little bit, and I want to close each week in a prayer. Sometimes it'll be a prayer that I just say right out of my own thoughts, and sometimes it'll be a prayer that I read from. So today I'm just going to say one that I think applies to health promotion and breast cancer awareness and prevention. If you like these doses, please like my page, A Dose from Dr. Denise, and share this with others so that it can get out there to the world, because I really want to make sure that we're vibrating at a high level. So let's close in a prayer. God, thank you for my amazing body. Thank you for keeping my body healthy. Thank you for the awareness to make good choices with the foods that I eat, and what I drink and how I move my body, how I restore my body through sleep, how I intake good nutrients in my body, and how I spend quality time and quiet time to make sure that my thought life aligns with the thoughts that you want me to have. Lord, if I am challenged with a cancer diagnosis or going through it or have a family member, please help me to vibrate at a level of love and not of fear. Surround me with a good support system and the right doctors that will help me go through that challenge and get to the other side with good results. So thank you, Lord, for all the things that you give me. Thank you for my health. May I recognize that health is my number one asset and should be a top priority in my life. In your name we pray. Have an awesome week. Peace out, and I'll see you next Sunday.